understand that teens are at low risk for COVID infection and severe disease. Do I really need the COVID vaccine? Yes. While the risk of kids and teens dying from COVID disease is much less than it is for adults, those less than 18 years of age are becoming an increased percent of the cases, up from 3% of cases to now as high as 22% of cases. More teens are getting COVID now than those over 65 years of age for every 100,000 people. Even if you only have mild disease, or even if no symptoms at all, teens are still at risk for other complications, such as long COVID, which can have a patient suffering from a variety of debilitating symptoms for several weeks or even several months. I'm not worried about catching COVID myself, so why else should I get vaccinated? No one wants anyone they care about to get sick. In addition to protecting yourself, get the vaccine to protect your friends and loved ones. But also enjoy the perks of being amongst those who are vaccinated. You will reduce your risk of missing a big game or competition due to COVID. You can look forward to traveling this summer with less restrictions, and who doesn't want to get back to hugging their grandparents and friends? Will I be able to go to school and participate in my activities after getting the vaccine? Yes. Although some people have some short-lived, expected side effects that may have you feeling less than your best, in the trials, teens experienced the same minimal side effects seen in adults, such as a sore arm, headache, fatigue, and muscle aches. But many people had no side effects at all. The trials confirmed the safety of the vaccine in teens, including the fact that there has been no evidence that the vaccine can affect your fertility in the future. I already had COVID-19. Do I still need the vaccine? Yes. Getting COVID again is possible, and the immunity or protection you get from having had an infection is not as strong or long-lasting as the immunity you develop from the vaccine. Even if you don't get sick from COVID again, you could have an infection without symptoms and spread it to your loved ones, including younger siblings who aren't eligible for a vaccine yet. Do I need my parents' consent to get the vaccine? Yes. For our county locations, your parent can consent when they schedule you for an appointment online. Alternatively, they can come with you when you get your vaccine and give their consent in person. If your parent can't come with you but has consented online, please be sure to bring a photo ID with proof of age. I encourage you to check with your primary care provider with any additional questions you have. You can also get this information and more on the CDC, California Department of Public Health, and San Diego's own coronavirus-sd.com websites. I have them all bookmarked to stay up to date.